When we think of early life nutrition, many of us focus on what's in it. Proteins, fats, vitamins, but the complexity of human milk goes far deeper than just a list of ingredients. The more time I spent studying it, the more I came to appreciate that human milk is not merely a mixture of nutrients. It's a complex living system. And that realization pushed my colleagues and me to ask a different kind of question. What if the structure of nutrients matters just as much as the nutrients themselves? Now, one of the most unique features of human milk are its fat droplets. They are large, wrapped in a complex milk-fat globule membrane that look very differently from the small, simple droplets typically found in standard infant formulas. And this made us wonder whether these structural differences might affect how infants digest and absorb fats, which seemed like a small question at first, but it led to some pretty profound insights. Now, to explore this further, the first thing we did was set up a lab model to simulate infant digestion and intestinal absorption. With this system, we compared 3 infant formulas: a standard formula, one enriched with additional milk-fat globule membrane components, and our Nuturis concept formula, which contains large lipid droplets coated with milk-fat globular components. Now, we expected to see some differences, but the results surprised us. The larger, phospholipid-rich droplets in the Nuturis concept formula broke down in a completely different way. They were digested more gradually, releasing fats in a pattern that looked much closer to what happens with human milk. That's when the work suddenly became personal. Last year, my wife and I welcomed our son into the world. And now, when he's being fed, I often find myself thinking about what's happening inside his tiny stomach. And it's reassuring to know that the science I've spent years working on is directly supporting his growth and development. Now, what our team has shown is that fat structure matters. It actively shapes digestion, nutrient uptake, and availability during this critical stage of early life. And now that we've observed these effects in the lab, we're preparing to see how they play out in the real world. Of course, we know that lab models can't fully capture the incredible complexity of the infant gut, but they give us a strong foundation as we link these insights to clinical studies and continue learning how structured lipids may influence growth, metabolism, and even long-term health. Because sometimes, innovation in nutrition is simply about learning from nature and making the best possible use of what it has already perfected.